this is Brian at with HowRadiologyWorks.com. Today we're going to talk about acute radiation syndromes. So these are the effects that happen when the body is exposed to very large doses of radiation. Typically, for instance, gamma rays or neutrons, something of that order that's a very high radiation dose. So if you're new to this channel, what we do is we have bite-sized content about concepts in radiology. So if that's something that's interesting to you, click below to hit subscribe and then click on the little bell icon if you want to get notified when we release new content. So again, today it's acute radiation syndrome, and specifically there's a few different types of acute radiation syndrome that we're going to be talking about. These have differences in terms of the radiation dose which is needed for those syndromes to take place, and then differences in terms of their timescales and their mortality. So acute radiation syndrome, there's a few things that are necessary for acute radiation syndrome. It has to be a large dose, so at least 0.7 gray is the approximate dose before you'll see symptoms of acute radiation syndrome. And then anything above that in terms of higher radiation doses. Typically external, very penetrating radiations, such as neutrons, gamma rays, high energy X-rays. These can all lead to acute radiation syndrome. In acute radiation syndrome, the entire body receives the dose. So if your hand or your finger receives a very high radiation dose, you wouldn't necessarily have the same effects of acute radiation syndrome that we're going to talk about here today. So acute radiation syndrome occurs mostly in areas where the whole body has been irradiated. For instance, a radiation worker in a nuclear accident or after an atomic bomb. And this dose happens quickly. So this dose is given all in the matter of either seconds or minutes. And this is often the case in these situations. So we're going to go through 3 different types of acute radiation syndrome with increasing radiation dose, and unfortunately the mortality is even worse for each one. So in the case of the first one, we're talking about bone marrow syndrome. So first off, all the blood products are actually made in the bone marrow inside of the bones, and the blood products actually start off as stem cells. So those stem cells, they can become the different types of blood products, and they're constantly being remade inside the body. So in a normal, healthy person, you have 10 to the 11th to 10 to the 12th cells being made every day. New blood cells being made every day to replenish the supply. So if something happens, such as a full body irradiation, where this is irradiated, if something happens, in that case, we're going to have significant health consequences. And full body irradiation prevents those blood cells from being remade effectively, and the effects actually depend on the dose. So for very low doses, like we said in the last slide, down to doses as low as 0.7 gray, you can see effects of the bone marrow syndrome. But up to about 2 gray is what we call lethal dose to 0% of the population. So you're very unlikely to die if you have a radiation dose of up to 2 gray in one of these short time windows like we're talking about. That's LD0. LD50 is around 5 gray. So LD50 is around 5 gray. So about 50% of the population will die if given an exposure to 5 gray. And then LD100 is about 8 gray. So 8 gray and above, basically 100% of the population will die of bone marrow syndrome if they don't die of something else sooner. And that's what we're going to talk about in the next 2 slides. are syndromes which are actually worse in magnitude and which hit quicker. So again, full body irradiation, the problem here is that the blood supply cannot properly be replenished because those stem cells cannot be converted into the blood products. And then after that, at doses that are higher than what we talked about there, the range there was in the single digits of gray, and grays that are basically in the double digits, so 10 up to 100 gray, that's where gastrointestinal syndrome is the most problematic. So in bone marrow syndrome, we're talking about 30 to 60 days for death to occur in individuals that do end up dying. In gastrointestinal syndrome, we're actually talking about only about 10 days from the time at which the accident occurs, or the time at which the exposure occurs, until the individual ends up dying. And the cause here is inside of the gut, inside of the intestine. If here's just a schematic of the intestine, and then inside of the intestine, there's linings and there's crypts, which are these small areas where there's basically indentations within the gut. And then there's a mucosal membrane, which is going over all of the inside of the gut. And that mucosal membrane is also, just like the blood cells we talked about, that mucosal membrane is also being replenished constantly. And because those cells die and are not able to be replenished, this is why GI syndrome leads to vomiting and diarrhea and is typically fatal, because the patients typically continue to have these symptoms of vomiting and diarrhea and have trouble even keeping proper water in the body. And so a GI syndrome, while relatively rare because of the higher doses, this is fatal. And if you have a radiation dose above 10 gray, the GI syndrome will be fatal, and it will be fatal within about 10 days. Finally, the absolute worst of these cases, which is actually the least well known, is called cerebrovascular syndrome. And then sometimes it's also referred to as a central nervous syndrome, or CNS. It's more appropriately called a cerebrovascular syndrome because it has to do with the vasculature in the brain and not just the neurons in the brain. So if the cord itself, if you only irradiated the brainstem, even at these doses, you would not have the same effect. So it has to do with the full body irradiation and the effect on the cerebrovascular system. And this effect on the cerebrovascular system, this breakdown of the cerebrovascular system, leads to increased fluid within the brain. And that increased fluid within the brain, it's a rigid skull, so that increased fluid within the brain leads to higher pressures. And those higher pressures, again, similar symptoms: vomiting, diarrhea, disorientation, ability to hold your balance. This is fatal within 1 to 3 days. And again, this is doses. There have been cases reported down to 80 gray, but typically it's just specified as about 100 gray and higher for the cerebrovascular syndrome. So here's a takeaway where we compare all the 3 different syndromes. And this syndrome, if you have a high enough dose, the bone marrow problems will end up being lethal. But these 2 syndromes, the gastrointestinal and the central nervous system syndrome, or cerebrovascular syndrome, those actually will be lethal even earlier. So the issue here again, is that in the bone marrow case, we're not able to make blood products. In the GI case, we're not able to have the lining of the gut to be able to be replenished. And in the CNS or cerebrovascular case, there's too much fluid which is accumulated within the brain. And then the time that these go on, in the bone marrow case, it's 30 to 60 days. And typically, if it's a relatively lower dose case, what happens is they'll treat with antibiotics because those treat basically the secondary infections. So antibiotics can roughly double for the lower doses, roughly double the amount of patients that are able to survive. And even beyond that, there's a narrow range of higher doses where sometimes a bone marrow transplant, in addition to the antibiotics, can be beneficial. But for most of that dose range where the patients will survive, actually just waiting, watching, and giving antibiotics is typically the course of action. And then like we talked about, the LD0 is 2 gray. So if you get below 2 gray, you're very likely to survive. The LD50, so 50% of the population will die with a dose of about 5 gray. And the LD100 is about 8 gray. And then for the gastrointestinal syndrome and for the cerebrovascular/CNS syndrome, those are 100% lethal. So again, this has been one of the least fun lectures actually to talk about because of the severity of these conditions. But in general, one thing we want to keep in mind is these are orders of magnitude above the radiation doses of diagnostic imaging. And we'll go into that more when we talk more about the units of diagnostic imaging and the way that the radiation doses are measured in diagnostic imaging. But it is important to understand these effects because these are real effects when there are people that undergo acute, very high levels of radiation dose in very short time periods. Again, if you want to have all this information, especially that useful table, to be in one place for reference or for studying, head on over to How Radiology Works /radbio for a cheat sheet on the radiation biology. Thanks again. Again, this has been Brian Nett with HowRadiologyWorks.com.